And welcome to the Wound Care Industry Town Hall. Next slide, please. So today what we're trying to do in the Town Hall is we're trying to provide an opportunity for our wound care industry partners to connect as a community and discuss the following: the impact of COVID on their business, current trends being employed, future strategies, and any other concerns you have. We started this process by issuing a small survey, which a number of you completed, and thank you very much. And we'll go through the results of that as we go through the Town Hall. So let me introduce our panel. For our Town Hall tonight, we have Cassie Alverson, who's the Marketing Manager for Wound and Skin Care for Coloplast. Would you like to tell participants, Cassie, something about yourself?
Hello, everyone. I was just introduced, Cassie Alverson, and I've worked with Coloplast for the last couple of years now, and I'm excited to be here today to talk about how COVID has impacted Coloplast from a sales and marketing perspective.
Okay, thank you, Cassie. And Patricia?
Hi, I'm Pat Coots. I am a registered nurse, and I work in a freestanding clinic in Mississauga. And I've been doing wound care for 30 plus years, and I'm very happy to be participating tonight.
Thank you, Pat. Janet?
Hi, I'm Janet Daglish, and I'm with Bayshore Healthcare, which is a home and community-based organization. I've been in the healthcare sector for over 18 years. One of the projects that I worked on was with provincial jurisdiction on implementing outcome-based pathways for wound care. And I learned a lot about wound care, and that was many years ago, and that just helped me in supporting our clinical practice at our organization, where we deliver care across the country. And I'm a business person, I'm not a healthcare professional.
Thank you, Janet. Shelley?
Hi, everyone. I'm Shelley. I am the Director of Clinical Engagement at Medline Canada. I am a passionate wound care nurse. I've been with the wound care industry now for 25 years. And I was in the first graduating class of the IAWCC. I think I was with Pat, actually. And very proud to be a nurse specializing in wound ostomy and continence. I appreciate this opportunity, and I'm really looking forward to this evening. Thank you.
Thank you. Thank you, Shelley. Dr. Mayer? You're on mute, Dr. Mayer.
Sorry. Thank you very much for pointing that out. I'm Perry Meyer. I'm a wound specialist here in Hamilton, Ontario. I have a wound center, the Meyer Institute there, which is a center of excellence. We try anyways, dedicated to the treatment of the diabetic foot. And I too have been in wound care for now just over 30 years, and look forward to the discussion.
Thank you. And for those of you who may not know me, my name is Douglas Queen, and I'm a wound care consultant. I've been in the wound care field for 35 years. I know I only look 21, but trust me, I've been in the wound care field for at least 35 years. So if I have the next slide, I'll begin the discussion with some of our panelists. So let me start with Perry. Perry, as a clinician, can you talk to these three questions and give us a little background in respect of how COVID has impacted, if at all, your business, your patients?
Thanks, Douglas. So, yeah, well, obviously, the pandemic really has had a significant impact on the business side of things. And early on, the negative impact really was the reduction in patient visits, not because we were closed or anything, but more so that patients were fearful of coming. And I think that everyone will share this same sentiment that this is what the patients were really, they were having difficulty making decisions about whether to leave the house. A positive aspect of it was that I think we had more dialogue and more meaningful dialogue with our patients, and we connected better with them, I think, during this time. There were lots of questions, and that generated interest in in discussion. And I think that was really a positive aspect of this ridiculous situation that we find ourselves in. But as far as the new normal for us, I think that, you know, a lot of wound clinicians have been doing virtual care. We don't do a lot of that, although it has, you know, it depends on what your definition of that is. We do a little bit more in the realm of pictures being sent via email or some kind of secure portal. I do a few virtual visits to the nursing homes, but not many. We see that as part of our practice, but really, I think that the new normal for us is more education and trying to ensure that the preventative aspect of our work is executed perfectly by the patient. And that's a lot of work. Obviously, it's easy to say that, but there is a lot of burden on them being in this mental state that they're in. Makes it a little bit more difficult, quite a bit more difficult. The lesson that that the pandemic has taught me as a physician is that we need to be patient. And you know, if anyone knows me, that's not my strong suit. So it's been an exercise in methodically going through the things that will calm patients down and keep them out a bit longer. That's our biggest lesson right now, is that we've learned how to move those appointment times out a little bit so that we have a bit more breathing room.
Okay, thank you, Perry. Pat, as a fellow clinician, looking at these three questions, can you give some perspective with respect to the patient and how it's impacted them, and at the same time, how it's impacted you as a nurse and delivering wound care?
I echo Perry's comments in that there's been a lot of education that's needed to go on. What we tried to do in the beginning was do more virtual consults, but it turns out that one of the lessons that we learned is that you really can't do a good visit virtually unless you have the whole team. And what we've ended up doing is having nurses and patients send photos to a secure portal, and then trying to coordinate the phone call or the visit when the nurse is with the patient. It's taken a little bit of finagling and working around so that you can make this happen. It also kind of interrupts your flow of patient day. The number of people that we're seeing have been significantly reduced. Our waiting room is closed, so there's no place to sit down. So people have to wait in their cars to come in for their appointments. The other thing that's been happening as far as the patients are concerned is they have become more responsible for doing their own dressings and their own assessments. And very many of the patients have been giving a prescription for antibiotics to have on hold just in case that they need it. And they're educated about the signs and symptoms of what to look for if an infection should happen and that they should need to start the antibiotics. This being the new normal, I think with wound care, it's a very unique situation in that unless you're working with a really good team that is willing to share all of the information, and the nurses in the community for the most part have been very good at doing this, you still really need to see that individual in person because as a nurse, I find that the patients will tell me one thing and then they'll tell the physician something else. So you need, and they tell the community nurse something else. So you need that whole team. It's been a very interesting journey through all of this. The other interesting thing that I will point out is that we're all in gear. We're masked up, we're face shields on, and the patients don't get to see us. So when you're seeing new patients, they have no idea what you look like, and they don't remember your name. They have nothing to identify you with, which is an interesting sidelight to this whole thing.
And how do you think the patients are taking this?
How do I think the patients are?
Yeah, reacting to all of this.
They're not really happy. The people have been forced into, because of the situation in the community, most of the patients that are being seen are going to the clinic. And like Perry said, they are afraid or hesitant to go out and be in contact with other people. And we've heard reports that people get to the clinic and they have to wait and they don't know who's there. The family members are not really happy doing the dressings because they don't feel confident, although we do send them to Wounds Canada website about doing dressings, but they still really need a lot of hand-holding. And we find that we're receiving more phone calls from the patient and or their family about things that we hadn't been receiving phone calls before when they were having regular visits or the nurses were coming into the house. And the other thing is with this pandemic, the patients are not liking having different nurses come all the time. Some of them have actually opted to find a way to get to the clinic so they could go to one place.
Okay, thank you. Perry, a quick question. How do you find within your own practice how all of this has affected your healing rates or healing abilities?
It really hasn't affected it too much. I mean, to be honest, it's really been business as usual in the sense that we didn't close, you know, unlike Pat, I understand the waiting room problem. That's a big problem. So if you have a tiny waiting room, you got a real problem dealing with your backlog. And so we have a very large sort of reception area, and it really hasn't changed much, to be honest. I think that the healing rate remains the same, although we've had some patients who've had to be out a bit longer, whose wounds have deteriorated, and we had to scramble to kind of catch up. But by and large, we're unusual in that we had the capacity, we have the size, and really the size is really revolves around the waiting room. So the rooms themselves are fine, or the area that we see people, but the waiting room is a problem. So that isn't for us, and so we've been lucky that way. But we too send people out in the car, and but again, so sitting in the car doesn't affect the healing rate. They're there. We did okay, and I think that our healing rate remains the same as it ever was.
Now this is for either you or Pat to address. But you know, having been around wound care for a number of years, I know how difficult it is in respect of time management for a wound clinic, because you just don't know what you're going to be faced with when you see a patient and how long an actual appointment is going to take. How have you found time management within the pandemic? Has it got better, worse, stayed the same?
Pat?
Our time management has probably gotten better because we've decreased the number of individuals that we're seeing here in the office. Right. So we're about half capacity, which has allowed us to kind of do the protocol of wiping down the surfaces and that between the patients. So our time management is better. We tend to run on time instead of a couple of hours behind.
Okay, is that the same for you, Perry?
No, so yes, we run on time. We've built in, we're kind of lucky this way in that, you know, we've got a routine and a down where we're able to kind of whip 3 people through, and our wipe down and all that is done in a very sort of methodical way. We kind of don't think about it too much. So our efficiency has improved because we've had to introduce all these other things, but we've also introduced some efficiencies that have bought us some time, and we've done some small tweaks on how we transfer data and whether or not we take as many pictures as we do. As funny as it might be, we we take pictures with our wound measurement app thingy, but we also do it with the DSLR. So we have two sets of pictures that are going, and that's sort of cumbersome. So we've eliminated the DSLR for the moment, and it's bought us about a minute per patient. So that minute per patient sounds like not much, but when you see 70 people in a day, it adds up. You know, it's an hour and change, and that you buy back, and that is an efficiency that really translates to being able to move people through a little bit faster and being finished on time. So that, you know, the nurses are already under the gun and they're, you know, they're working really hard. It's makes it worse when they have to stay late, you know. So I like to get people out of here by 5 and all things done. And we've really tried to hone our record keeping and documentation process down so that we really get it tight and there's no time wastage doing duplicate maneuvers. So, you know, transferring data twice, that kind of thing. And those little tweaks have bought us a little bit of time to make it substantially more efficient. I mean, there's a lot of things to do extra, you know, like we got a fogger. If that's, you know, a fogging, cleaning down all the surfaces in the reception area, just as an example, took maybe about 10 to 15 minutes. That was by hand, spraying it, wiping it, all that stuff. Now we fog it. We bought a fogger, you know, those mister thing, a big thing. It sounds like a jet engine, and we fog, and we can fog in about 3 minutes. We can do that multiple times during the day. So there's a lull in the action, and the waiting room is sort of half empty. We'll fog half of it, and then when the other half, we do that. So we can do it multiple times during the day, and it doesn't take very long. It may maybe 2, maybe 3 minutes tops. So that's helped us with our efficiency.
Okay, thank you. Just remind people participating in the town hall, there is a Q&A facility in Zoom or chat that you can send questions, and we'll build them into the presentation as we move along. So feel free, and if you could direct who you want the question to go to. If you wanted to go to a specific person, then please say so. Taking a slightly different tactic, because we've looked at the clinical side and obviously the patient side, and thank you, Pat and Perry, for that synopsis. I'd like to look at it from an industry perspective. Obviously, patients find it difficult to see clinicians. How difficult is it for industry people to actually get in to see clinicians? And perhaps we'll start with Shelley. You can address these 3 questions in your time frame. That would be great. Thank you.
Okay, thank you. Well, we've had very little access to no access at all to the clinicians over the last year. In the West, wound clinicians were either redeployed to other areas of the hospital, particularly after the first wave, when we really didn't know what we were doing. And then the remaining wound clinicians were busy doing virtual visits, basically. And it's really remained that way until I would say last September, I think, is when we started sort of seeing a bit more action again. So that's really been the negative, because we've had to really figure out ways to do things that we would normally do face to face. And I'm speaking more on the Western Canada, because I think we've realized that there are regional differences as well, because it could be quite different in Ontario, but that's been my experience here. From the positive side, I would say personally, it's been challenging for me as a nurse, watching my nurse and physician colleagues dealing with what they have to deal with. In a way, I have felt a little bit of guilt, thinking that I should be out there helping, and I'm not. But what it has done for me is made me very sensitive to the needs of the wound clinicians and very respectful of their time. So I have a tendency to really back away and just sort of give them their space and only sort of answer questions as they come about. So that's kind of the way I've operated. I think the new normal is going to look very much like a hybrid. I think what we've learned about virtual education is that it can be quite easily done with obviously a wider audience. We can reach a lot more people. I think technology initially was a real challenge, particularly in long-term care, where I often do education sessions. They just weren't set up for doing virtual education. So that's taken a while, but it's coming for sure. I also see a reduction in travel expenses, because I would say 75% of my life before I was traveling, and now I've been in an office for a year. So that's been very different. I've enjoyed that part of it. But I could see that maybe in the future, I may not have to travel as much. We may not have to do all those in-person visits. So that may change a little bit as well. I think the key lesson for me is how resilient we've been, and how creative we all are, because we've really had to adapt to this new world. I mean, it's changed everybody's world in different ways. But whatever can be done in person, I know I can do it virtually. It may take a little bit longer and more patience. I think Dr. Meyer said that, but it can definitely be done. And from a larger company perspective, because I do work for Medline, as you know, a big part of Medline is the PPE product. And I think what we've realized there is the importance of the supply chain, and how essential it is to the success of our company, and most importantly for customer satisfaction. So it's been a huge lesson for all of us. Thank you.
Okay, thank you. The quick question, Shelley, the impact that you've seen specific to wound care, since Medline's such a diverse company with such a diverse clinical portfolio, has that been mirrored across each of the clinical areas for the most part?
You know, I think it has been in the OR specifically. I think some of the reps have been able to access the OR because they're a little bit more specific, and I wouldn't say more important, but more timely. They need to be there. But and then of course the PPE business has been very important as well. So it's been important to get the clinicians what they need. And that's been challenging as well, because as you know, there's been a global supply issue. We just can't meet the demand. So then it was prioritizing who would get what. So there has been definitely a lot of challenges. As far as wound and skin, it definitely, as I mentioned, has had a huge impact. But for those that need anything, they get me right away. It's that, I guess that's the positive for the clinicians who try to reach out.
Okay, thank you. So before I move on to Cassie, there's one question come through Q&A, and I'll direct it to Pat. It says, hi Pat, you mentioned that patients not being able to see you and remember your name. I've seen some instances where HCPs have put a headshot adhered to their PPE. Is that something that you have considered?
Thank you for the question.
I'm sorry, yeah.
We've actually considered it, and we didn't do we did a trial run with just kind of a paper headshot, and by the second patient it was such a mess you couldn't see who it was, because of just the wrapping and all the motion that goes on. We haven't revisited it, let's put it that way. It hasn't been high on the priority list. But thank you for the suggestion, and it's a reminder to take it on further. Thank you.
Thank you, Pat. And if you want a really good picture, I've got some from you from 20 years ago that you can put on and show the patients.
That would be good, Douglas. 20 years ago would be great.
So moving on, Cassie, you work for Coloplast, and Coloplast covers both the US and Canada. So while you're answering these three questions, if you could bring in some aspects in relation to any differences you've seen between the US experience and the Canadian experience, that would be great. Thank you.
Yeah, that's no problem. So from a North American perspective in sales and marketing, I think everybody on this line can relate that it was really challenging at the beginning, you know, understanding if facilities were set up, understanding people's learning curves. And people needed time. They needed time to really learn these webinar platforms, and also a different type of meeting style too. And when it comes to, you know, our healthcare professionals' time, we needed to be more mindful. You know, everybody was in a bit of a state of chaos, I would say. So, you know, being organized digitally or virtually was key here. And, you know, for example, when our territory managers were, you know, just at the start of working with our Teams platform more and more, you know, they made sure that they had a clear agenda, set objectives too, and had very simple digital tools that met our HCP's needs, right? And, you know, right now what we're seeing in the US is that, you know, 20% of the population has had both their vaccines, where in Canada, you know, 20% from the last statistics I saw have only had their first vaccine. So, and, you know, about 2 to 3% have had their second vaccine. And from looking at the territories in the US, you know, 50% are able to get in to see the customer, where it's very, very limited still up in Canada. So, you know, that's what we're seeing there. And as far as, you know, a really positive aspect that I really love seeing from our Coloplast team is the fact that we're really good at sharing best practices, and it's really taught us a lot. Best practices of maybe something just simple as, you know, doing a virtual meeting, maybe something our customers have been doing. But really, I think we all can agree that there's been no handbook on how to deal with COVID. So seeing those best practice sharing techniques have been really beneficial for us. And when it comes to also what we see as the new normal, I believe Shelley said something, but to this extent, but really increased efficiencies and time management for everybody involved. You know, time is really of the essence here, and you know, we'll continue to see too the virtual initiatives, the savings on travel internally, and you know, being in person if and when it makes sense, but also providing digital options when it makes sense too. And when it comes to also that third question about what has, you know, what is one of the key lessons this pandemic has taught the business or the industry? This is an interesting question, but I really feel it's, you know, really, again, being mindful to the fact that we cannot control everything that life has handed to us, but we can really try to control the experience to the best of our ability. And so, you know, just continuing to listen and respond and have that heightened sense of empathy and leading with that empathy, you know, to make sure that stakeholders, internal, external, are taken care of is really been a great lesson there. And just seeing how fast that we can adapt to the services that we provide our customers, as well as, you know, just education in general. It's just been a huge learning experience. Unfortunately, you know, no one asked for this pandemic, right? But we've all been able to come together and learn something.
So let me change tactics, and we've heard from the clinical side, we've heard from the industry side. I suppose this sits somewhere in the middle, although Janet may disagree. Let me move to Janet and ask Janet to answer these questions in context relative to delivering home care and a service type business. Thank you, Janet.
That's great. Thank you, Douglas. Really appreciate. You know, I think it's important for us to start off and look at a review across Canada around how it's impacted different provinces differently because of policy and decision making. So one thing we saw, just to give a quick snapshot, Alberta reduced their home care services by about 50% right at the beginning in order to create capacity. And services still haven't fully returned to pre-COVID levels. In Ontario, we saw an immediate reduction of about 30% of services. Of course, therapy services significantly more negatively impacted. But since then, we've actually seen volumes increase significantly since previous year. In the East, we didn't see the same impact, and actually we saw quite a bit of consistency in the level of services that were offered. So I think it's interesting that different jurisdictions responded to this COVID in different ways. I think the most impactful change, though, for our business was having to pivot quickly to virtual visits, particularly for our nursing and significantly for our therapy services. And we had to start to make decisions around and assess when in-person visits were still needed for that particular patient. And our focus on virtual became, really how could we support coaching and education, symptom management. We were able to do therapy assessments using virtual, using our digital health platform that include, a health Zoom account, and that was a way as well that we could engage family members who may not actually be with the patient at that time. So we saw this as a great opportunity to introducing virtual technology into the delivery of care. But I think it might be interesting to focus on, when COVID started as a crisis management, our focus was on developing an appropriate governance framework for our organization, and then a communication plan. That was critically important for us to be able to support staff in understanding what needed to change, and keeping everybody up to date, all of our frontline clinicians on the new directives and practice changes. One thing that was identified earlier, which I just want to reinforce, was one of our biggest challenges has been sourcing of appropriate, sufficient PPE, as well as we face product shortages and substitutions. And what are our learnings from that has been, it's really reinforced the use of generic categories of dressings to make sure we're still able to provide evidence-based and best practice. We went through a whole cycle of different PPE shortages and starting to source from international, at skyrocketed prices. So there's been a significant cost and impact from that. I wanted to also touch on, changes to our risk assessments at point of care. We had already had very good IPAC practices in home care and risk assessments based upon H1N1, but this really required evolving our policies almost on a daily basis as new evidence was evolving and our learnings, right from across the world. So that was really impactful. PPE inventory and supply ordering, we found very quickly, we have over 100 sites across the country with over 100 branches, more than 90 infusion clinics, 13 production sites for our pharmacy business, and our National Development Center. And so we had to build the technology as a dashboard to ensure we had appropriate supply right across the country. And that in itself was a big learning for us on how to turn that around very, very quickly. I don't know if it's helpful to mention, but the different public health units in one province in particular has been very challenging. Ontario has 34 different public health units. They have different health authority or LHIN regions, and not all retirement homes, as for example, we're interpreting policy and directives the same consistent way, which impacts the way that we had to support point of care testing, rapid testing, and or PCR testing for our staff. So, it really has been challenging, I think, for all of our frontline staff during COVID. Reimbursement, of course, of PPE has been extremely expensive. And, you know, I'm very proud of the fact that our clinical practice team were making decisions around masking policy, for example, well ahead of public health guidelines. And for that, we have seen very, very low levels of COVID positivity in both staff and our patients. You know, that's because of our proactive approach in supporting our staff, and, you know, educating on proper donning and doffing, you know, had to, and re-educating and supporting them on a daily basis through our clinical management team has been part of our success. What is the new normal? New normal is virtual is now incorporated into our daily practice, whether it, and how we fit it with in-person care, you know, it's just the new way of being. As well, we figure that PPE is the new normal. So IPAC practice is always going to be front of mind for all of our staff, whether they be our nurses, our therapists, or our personal support workers. IPAC is now always front of mind. So, you know, we've also seen the new normal is patients are more invested in self-management of their chronic conditions. Why? Because patients are actually avoiding hospitals. They're trying to avoid physician visits, and they're certainly trying to avoid placement into, for example, long-term care for our older patients. So they are more invested, we find, in that self-management. And I think the biggest learning that we've had from this is really how we've had to pivot to empower families to better support patients. And that's had the impact of having better outcomes by engaging families in the care plan, because we haven't always been able to ensure an in-person visit. So supporting those family members, and we have been using the Wounds Canada family teaching tools, and we're able to share them with families, and it's been a really good experience.
Okay, thank you, Janet. Before I move on to the next slide, we have a question that's came through. I'm going to do a quick round robin to each of our panelists. And basically the question is, do you feel the business relationship between industry and clinicians has improved, deteriorated, or is about the same, and why? Let me ask Shelley first.
I would say it hasn't changed. It's almost like having old friends you haven't seen for a while, and then you pick up where you left off. Basically, we've all been involved, so focused on getting through this that the relationship really, we haven't been able to work on it, obviously, but nothing's been lost either. In fact, I think we're happier to see each other because it's been a while.
Okay, thank you, Shelley. Pat?
I agree with Shelley. The only challenge that I have is when the representatives change, not knowing that they have changed. So I'm relying on my older contacts in the particular company to say, can you help me out? And that again comes back to that old friend. You have that contact, if not with the person who is your rep, with an old friend that you know that was a rep at one point or is a rep in another area. So it hasn't changed all that much other than that.
Okay, thank you, Pat. Janet?
I think about a particular story. You know, as I mentioned, we saw some shortages and short supply and back orders and such in some cases, and had to pivot very quickly. But I do recall at one point we were, and I'm not going to mention which, but we were suddenly facing a significant shortage on a very critical item. And, we had exhausted every possible distributor. We had approached manufacturer. We tried to do everything. And, I only share this because it fits so well with Pat's comment is, I happened to know somebody, and I picked up the phone and I said, can you help us out? How do we don't want to have any patient care negatively impacted from this. And it was me making a phone call to somebody who's the brother of somebody who went through high school. And guess what? We got enough to get through. And sometimes it's about, just staying connected through our networks and asking, and then being able to offer, what can we do to help you as well? It goes both ways.
Okay, thank you. Cassie?
Yeah, I feel that there was that sense of appreciation and relief, and to have that interaction. So we've received a lot of positive feedback from our healthcare professionals, and it was challenging at first, like I mentioned earlier, right? I mean, people were learning these new platforms and learning these tips and tricks on how to access things, but overall, I feel like it hasn't changed at all. If anything, it's gotten a lot better.
Okay, thank you, Cass. So what I'm going to do is I'm going to quickly run through the results of the survey we got. I'm not going to read every single word that's on there, but just give you a general feedback in respect to the results we obtained. That'll give you the opportunity to think up your questions and put them into the Q&A or into chat, whichever you want. And again, which particular panelist, if any, you would like it directed to. So the first question we asked, in what ways has the pandemic changed the roles, resources and interaction of your sales and marketing group? Well, the feedback we got, some of it's been touched upon by some of our panelists, but decreased travel, increased productivity, the two things may actually go together. Limited contact, clinical studies were delayed, everything became more virtual and it became a digital world, which is essentially all of our lives, not just our working life. All the meetings, trainings, in-services all went virtual, which ties to that. But that's one of the panelists mentioned the sense of immediacy and urgency that we all felt. And one of the participants or one of the respondents to the survey talked about changing on the fly. Well, we all know that because the government gives a great demonstration of changing on the fly. Because we get daily briefings, if not twice daily briefings from government. So those were some of the feedback that we got. Any of the panelists want to comment on anything there in general? Sherry?
I can.
Oh, sorry, Cassie.
Sorry. No, I can just say that, obviously our meeting styles flipped overnight, right? We had to learn more virtual. So there was that curve, but everybody seems to have adapted. And in sales and marketing, I don't feel like our roles really changed necessarily, but we had to really reprioritize our initiatives, which we were able to accommodate.
Okay, thank you. Any other panelists want to comment? No. This is I'll remind you that the Q&A is there in the chat. So I can have the next slide, please. So the next question that you were asked in the survey was, what feedback have you received from your customers on your virtual connection with them? One participant mentioned positive, which is a good thing. But for the most part, the general trends were too much virtual, an okay acceptance of what reality actually was, the initial hesitation, but things got better as the pandemic went on because we didn't have much choice. And a couple of participants or respondents talked about the customers felt live demonstrations were preferred and much more impactful. Perry, Pat, as clinicians, would you agree with the live demos being preferred, or do you have a view on that?
Go ahead, Perry.
Yeah, can you hear me?
Yeah, you're back.
Okay, so good. Yeah, you know, to be honest, I don't really need a live demo. You know, I don't think Pat needs one either. But you know what I did find that was really good was the fact that we could actually see more people. Like a lot of times the times that like I'm an early riser. I like 7 in the morning meetings, which the reps hate. So being able to do it virtually, I think was better for us. We could actually interact with them a bit better, and it was just better in general. I thought having them come in and during a day, certainly during the day when the clinic's on as a non-starter, you can't do that. But having a half hour carved out at lunchtime or at the end of the day virtually is pretty cool, and I really enjoyed that.
Thank you, Pat. Your feelings on that?
The only thing that I would add to this about the virtual connection is the webinars that are happening. Just don't, and this is just my experience, but they're just not aligning with my workday. I can't get on any of them. Either I can't get to the beginning or I can't get to the end. And what I'm finding is by the time I get home at night, I don't really want to hear anything more about virtual anything. I've had it. So that's been a challenge for me to keep up with what's new. I've actually had to, I've had to really make an effort. I can't join during the day, so I may have to register and then watch it at free time when my brain isn't been fried. So that would be my one comment. It's difficult when you're trying to see patients and do paperwork and keep all the connections going.
Just a comment on that, Pat, because I think you bring up a very good point. Obviously, when one meets face-to-face with a representative, you have a specific appointment, and live necessitates the event happening at that time. But when it comes to webinars, we have a live event and we have a on-demand event. Do we really need a live event for webinars when the on-demand part of it basically allows people to choose at their pleasure, which is essentially what you were saying as a requirement for overworked clinicians? So that might be something for our industry partners to think about. Do you really need that live event or just have things on demand? Anyway, that's just food for thought. If anyone agrees or disagrees with me, the Q&A's there, the chat's there. You can hurl abuse my direction. Maybe I'll ask our industry representatives, Shelley and Cassie, if they would like to comment on that.
Yeah, I think I would just say that it's a good point, because I'm the same for webinars that I'm trying to make too. I get so caught up in my day that I find I just don't have time to attend them. And then I think that I'm going to watch the on-demand one, but then I don't have time to do that either. So I'm not sure if on-demand is the answer either, because I just don't think that information would ever be watched. The one thing I would say for education over virtual platform is that it's really nice to see people's face. And when we started this, Zoom or whatever platform we were using, it was a lot of blank or black screens, which was really difficult because you still really like to have that connection. You like to see sort of the body language. Sometimes that's hard under PPE, but if I could recommend anything, it would be to turn on your camera because it really helps the presenter.
Okay, thank you. Do you have anything to add, Cassie? Or?
Yeah, I agree wholeheartedly with Shelley. And also too, I think, with our attention spans and, just being so drained too, with everything that's going on, to Pat's point, I think what is really helpful is even like bite-sized nuggets or tips and tricks, or even, things that could possibly help patients, maybe a little video. There's different learning styles too when it comes to embracing education. So, having both pieces available, but again, really at a bite-sized level, I think is very, very helpful from a sales marketing perspective.
Okay, thank you. And Ashley Hudson on Q&A made a very good point that in my elderly years, I was stupid enough not to realize, and that is on-demand would need to have some sort of interaction and interactivity, because obviously you have the Q&A component that you have at the live event. So that's a very good point, Ashley. So that was done. Could I have the next slide, please? There is a question in chat, but I'll come back to that one. Has your company had access to customers it considers necessary to support the education, product and servicing and logistical needs? For the most part, it was all a play on the virtual component. It was all a play on customers feeling virtual fatigue and no longer wanting to engage in that manner, which Pat was a very good example. Hospitals not being as open to allowing outside reps in, so it wasn't so much that there was no desire between customer and this industry. It was a mandation from the government. That's the right word. And yes, when really needed, but no, this seems to improve. And I can't remember. Oh yeah, for product and servicing. So I think there was some consensus that, to Perry's point, that in-servicing can take place virtually and it has some benefits, but there is some need sometimes for face-to-face. I could have the next slide, and then I'm going to open up for Q&A more broadly. So what aspects of the pandemic pivot have you experienced that you'll anticipate will remain post-pandemic? This is really interesting because everybody in their own personal life and working from home and can feel the same pain or gain, whichever way you want to look at it. But more work from home, more Zoom meetings, virtual webinars. I expect a hybrid between in-person selling and virtual moving forward, which may be a good thing, certainly from Perry's perspective, being an early riser. Limited access to customers, industry using more social media. Again, not a bad thing because social media, digital media is certainly the way forward. And perhaps certainly in our personal lives, we were perhaps more open to it. In our professional lives, perhaps we were a little bit more laggard. Low adoption in new technologies, and I think this ties in, whereas pre-pandemic, people began to realize that maybe they weren't as digitally prepared as they should be. Moving forward, I'm sure that's changing. More online content will be expected from companies, ties in together with the virtual component, but also from professional societies, educators and consumers. I think the most interesting one for me, and it relates back to on-demand webinars and to the point that Ashley made in respect of interactivity, but conferences will at least in part remain virtual because sessions with large groups may still be limited moving forward, or there may not be a desire for people to travel around and trying to get get to conferences, etc., because obviously it eliminates the expense and the time required. Next slide, please. This one's got a lot of information on it, but how has the pandemic affected patient access to product information services to support your products? Again, essentially it was all the virtual component and access. I think what's really interesting was, for me, from the survey was with elective surgeries dropping, less surgeon-patient interaction, there was some aspects there relative to getting information to patients, patient education, and that's perhaps where associations, etc., can make a play, to Janet's point with respect to WINS Canada and their Care at Home program. And again, that ties to patients themselves in respect of having to do more home-based care or self-care, where they have to find the information, and again, having resources that are virtually based that patients can be pointed to would be very useful. And I'll leave that there. Before I move to the next slide, I'll look at what's on Q&A and chat. This is a question in Q&A from Paul. Do you anticipate a large demand and need for wound care treatment as COVID has taken so many resources and wound care has been relatively ignored? What would be needed to prepare for increased demand and patients getting worse during COVID? Perhaps I'll push that one to Perry.
Well, the thing that's hurt us the most is the nurses out in the field and the resources. We rely on them so heavily. It's just like, they really, when there's a hiccup out in the field, you really feel it back in the office because, I think that as we, the COVID really has done that to us. Now, hopefully there can be some recovery now. And when the nursing sort of shortage is sort of remediated as time goes on, as COVID sort of starts to burn itself out, hopefully there's more nurses out in the field, and that will help us a lot. Really, that really of all the things that have happened with COVID, that part of it has been really detrimental to the care of our patients. There's a shift out to the wound care clinics, so they don't want to do in-home care because they don't have enough nurses. And so this is that's a problem for us. We need to have a certain number of patients seen at home and in home, and so that's really the only thing that really stuck with me, that COVID has really had a significant impact on.
It's interesting, today alone, 3 of our patients that we saw told us that their nurses, either from a clinic situation or a visiting situation, had either retired or moved on to something else. So I think the nurses in the community care, home and community care, are finding all of this very, very challenging. And if nurses keep leaving, it means the people that are left are having to take up more responsibility. And again, it's about the education, because we as nurses and physicians, we're not given a whole lot of education about wound care in our undergraduate studies, and and Janet, please correct me if I'm wrong, but I think a lot of the people that are coming into home and community care, because hospitals weren't hiring, went into home and community care as one of their first jobs, and it's been very challenging for them. So I think we're seeing an exodus, and I think that's going to affect us.
And with that, just to add on to that, Pat, with the exodus comes not only new people, but wound naive nurses. So that is the big worry of getting it's great to have nurses coming into doing home care, but these are green, they're wound naive. And so that learning curve is tough, especially when you're under the gun.
And I wouldn't mind speaking to that, Douglas. You know what? Thank you for recognizing the significant impact that COVID has had on the home and community sector. You know, I think one of the biggest challenges has been not to focus on this, but recognizing wage disparity and the pull of many nurses into the vaccination programs across the province through public health. We've lost a lot of our nursing capacity, and it is challenging. We usually, in a stable environment, require our home care nurses to have a minimum of 2 years experience before we bring them into home care. Why? Because of the need for such autonomous practice, and experience and skills are so critically important. When you have such a gap at this time, we're really looking for nurses who are able to come in and learn an area of expertise very quickly. So I wanted to highlight one of the comments about, you know, more of a just-in-time education is going to be helpful for supporting in that quick advancement in their practice and their skill in wound care.
Good, thank you, Janet. So we're getting close to the end here, so I may go 5 minutes over, which is unusual for me, but there's been lots of discussion. So a couple of comments that have came through is that one, from Doris, we found that a number of customers don't have the ability to use some virtual platforms. This has caused some numerous challenges, especially in introducing a new product to, excuse me, these customers. So I'm guessing there, Doris, means both patients and clinicians. Paul has commented on OTAC recommending the use of skin and tissue-based products such as acellular dermal matrix for DFU treatment to be paid for. So there is some interest in looking at new technology and adoption, even through these tough times. He's also commented on the need for good wound care education and giving the most up-to-date knowledge and training. So thank you, Paul. Ashley has asked a question which I'll allow to be the last question, and I'll direct to a couple of panelists, perhaps more from the clinical side than the industry side. And that's a question from Ashley, who has asked, how can industry support that learning need of wound care naive staff? I'll throw that one to Pat first.
That's a really good question. I think that a lot of the industry have education already prepared. It's kind of in the can, so to speak. Making the education as generic as one possibly can and making it relevant to the situation that the person is working in. So long-term care, people really don't need to know a whole lot about, they need to know some, but they don't need to know a whole lot about venous leg ulcers. They may need to know more about pressure injuries. So honing the education to the venue would be really helpful, I think, to those individuals. And Douglas, I just wanted to make a comment about not everybody being able to have the access to virtual. We forget that there's still some places in Ontario that are still on dial-up internet.
Yeah.
We just get so used to just turning on the computer and the internet being there, but there are still places that do not have that that capacity, and I think all of us need to be more mindful of that and figure out a way to do, whether it's a conference call, maybe not a Zoom call, but a conference call that several people can get on a line at the same time and have an educational session. Thank you.
That's a good suggestion, Pat. So I think that's it. There were a few other questions, but we've really run out of time, and I'm sure Rob will forgive me. So please complete the evaluation at the end, which the end is now. Stay tuned for a summary report, which will be posted on LinkedIn. And we hope to see you at Wound Canada's Limb Preservation Symposium on May 28th. Feel free to comment on LinkedIn or Facebook or any of Wounds Canada's social channels, or send a message to Wounds Canada if you've got any questions or any desire for something like this to be done again. I'd like to wish you all a good evening. I'd like to thank our panelists on your behalf and hope that everyone has a good night and that the snow doesn't come too much to Toronto and the surrounding areas, because it's a horrible memory that winter's back. But I suppose with the third wave of the pandemic, we expect anything. So good night and thank you all.
Thank you.
Night.
Good
Thanks
night,
very
everyone.
much. Have a good evening.